Good afternoon. I'm so pleased to be able to be here with you virtually this afternoon. My name is Denise Wolf, and I am new faculty here at Cedar Crest College. I just started in August. I'm assistant director of the art therapy program and teach in both the undergraduate and graduate program. I've been teaching for a great many years and have been adjunct faculty at Drexel University, Jefferson University, Villanova University, and University of the Arts. In addition, I'm a DBT clinician or dialectical behavioral therapy and worked for about 15 years in a residential treatment facility for adolescents. I work as a consultant for Mastery Charter Schools and the Philadelphia Art Museum, providing clinical supervision around trauma-informed work. I have a small private practice where I do clinical supervision and also see clients, adolescents and young adults with trauma histories, and in all my free time, work as a challenge course facilitator, high and low ropes courses for team building and leadership. That's just fun. So I'm here with you this afternoon to talk with you a little bit about a neurodevelopmental art therapy approach to treating trauma. So I'll kind of give a wide overview of trauma and PTSD. I'll talk a little bit about the neurodevelopmental impact of trauma, and then a little bit about art therapy and why art therapy is so well suited to treat trauma. I understand for the last 2 weeks you've been talking about trauma and PTSD, so hopefully you've been working on your sort of elevator speech on what trauma is. In the children and adolescents I work with, I usually say trauma is a scary, dangerous, or violent event that felt life-threatening to you or someone or something that you love and really threatened your sense of safety. Everybody who experiences a trauma does not develop PTSD or CPTSD, complex PTSD. Um, Trauma is a scary and unexpected event which can feel life-threatening. I find it useful in my practice and in research to make a distinction between acute and chronic trauma or type 1 and type 2. Treatment is actually really different for acute and chronic trauma. So acute trauma is a one-time event in an otherwise normal life that's usually short in duration and oftentimes resulting from a medical event, a natural disaster, or human disaster. Think about gunshot wounds, vehicle accidents, natural disasters, or human disasters like mass shootings or terrorism. Chronic or type 2 trauma is repeated and anticipated with persistent exposure, neglect, war, ongoing child abuse, physical or sexual abuse, multiple transitions and losses. Think about being housing insecure or living in multiple foster homes. Also poverty. So why brains, right? What does trauma have to do with brains? Trauma changes neural development. Trauma changes our brains and our neural pathways, right? If you think about the relationship between the amygdala, right, the fight, flight, or freeze part of your reptilian brain or old brain, and your prefrontal cortex or thinking part of your brain, right? The more the amygdala is activated by a traumatic situation, something that would prompt you fight, flight, or freeze, right? A saber-toothed tiger just came into the classroom, right? You're going to fight, flight, or freeze. You're not going to think, well, that's highly unlikely, and I have, 3 more chapters to review with a professor, right? So the more repeated exposure you have to trauma, the more the neural pathway to the amygdala gets used and becomes a stronger and stronger road. Brains are user dependent, so the more a neural pathway gets used, the more a neural pathway gets used. If the upper brain is underdeveloped, right, the thinking part of the brain, the PFC, we're going to have less access to be able to self-calm and control their impulses and maybe even engage then in crisis-generating behavior. Trauma researcher Bruce Perry has done some seminal work in NMT or neural sequential modes of therapy, and I've had the opportunity to train within his cohort or through his model. And he views the brain as an upside down triangle with the brainstem kind of where the amygdala lives, right, controlling things like our heart rate and body temperature. And then if you move up through the brain, right, and all the way to the tippy top or that blue part of the brain, that's your thinking part, that's your cortex or your PFC, prefrontal cortex. This is where the ability for abstract thought is and concrete thought. So in terms of trauma treatment, if we have an overactive amygdala or the person is in an ongoing or somewhat chronic state of fight, flight, or freeze, where we don't have access to that high part of the brain, the PFC, the cognitive part of the brain, where you see the recommended therapies are cognitive therapies like dialectical behavioral therapy, trauma focused, CBT, etc. And in that lower part of the brain, right, where alongside the amygdala and the reptilian brain, are things like rocking, swinging, bilateral stimulation. Think for a moment about rituals throughout history and time and culture. And what are those rituals around grief and loss, right? We can think lots about rituals that involve singing, drumming, dancing, and crafts like weaving and sewing. These are all inherently neural healing, right? They are bilaterally symmetrical, repetitive, and neural healing. And in a moment, I'm going to ask you to make those kind of connections to an art therapy practice. So if we think solely about neurodevelopmental goals of trauma treatment, right? If we think about treating the brain in response to trauma, we're going to think about trauma treatment a little bit differently than some more cognitive approaches like prolonged exposure or trauma-focused cognitive behavioral therapy, right? We're going to think about first working on the ability to self-regulate, right? To help the person move away from that continued state or ongoing state of fight, flight, or freeze and that overactive amygdala. Work on things like the ability to self-soothe, which has lots of application in art therapy treatment. Basic attachment, which is a whole nother lecture on the power of relationships to be healing and neural changing. So we'll just put a pin in that. Mastery and control through the senses, which again has a lot of application in art therapy treatment. If we think about mastering control of the senses through the content and process of art media. Moving up through the brain, from the low brain to the higher brain, and then getting into those relational or interpersonal and cognitive abilities. So, as I've been saying, soon we're going to talk about art therapy, and here we are, art therapy. So this definition is pulled from the American Art Therapy Association website, right? And I've highlighted in blue the things that I think are significant because I am aware that this is a big, chunky definition. So this is a mental health profession that involves the creative process to resolve emotional conflicts such as managing behavior, treating addictions, reducing anxiety. To be an art therapist, this requires a knowledge of visual arts and counseling theories, right? Art therapy is not just for children. Art therapy can treat a wide variety of mental health concerns, just as any other form of treatment. Art therapy is a master's level entry field. So although Cedar Crest College offers an undergraduate degree in art therapy, that's a preparatory degree to then go on and pursue a master's. So what is so darn special about art therapy anyway, Denise? Let's see, what do I want to say about this? First, art therapy communicates the way we experience things, which is all at once. Art therapist Harriet Waitson called this the spatial matrix. So think about this. Imagine that you were in a small fender bender on your way into school today. Everything's fine. You just have a little ding in your bumper, so tell anxiety to get down. But you're trying to tell the story of what happened to a friend of yours. And so it might go something like, I was driving down the road and then I took a sip from my coffee and then the sun was super shining and all of a sudden I remembered that I left the toaster oven on and then I heard this loud noise and this crunch and then my coffee cup rolled out of the thing. And so what you're noticing is a lot of and then and then and thens. And so when we experience something, we experience it all at once. But when we communicate that to someone else or even sometimes to ourselves, we have to put it in sequential language. And that doesn't really communicate the way that we experience it, again, all at once, or spatial matrix. So art making has the ability to communicate to self and others just the way we experience it, all at once. It's easier if I just draw you a picture. My mentor, Ron Hayes, would say that art therapy is like dropping a stone that goes to the bottom of the pond without making any ripples on the surface, right? Art making has a way to symbolically communicate quicker and more efficiently than words do. I'm a little bit older, so I use the metaphor of drawing a map. I know nowadays we can do things like throw pins at people, um, electronically, metaphorically speaking. But this is the idea that sometimes it's just easier to draw the picture to communicate something. And art creates this space that is sort of what Winnicott would call the transitional space. It's real but not real, or sacred space. Our brains don't know the difference if we experience something, imagine something, or dream something. So where does an art therapist work, or who do they work with? Anyone or anywhere that you would find any other mental health clinician. People who have developmental, medical, educational, or social differences, um, trauma resulting from, type 1 or type 2 traumas, like I talked about earlier, and any adverse health conditions, cancer, dementia, depression, TBI, autism, again, anywhere that you would find any other mental health clinician. So let's start to wind it all together. We've talked a little bit about an overview of trauma, neurodevelopment, certain neurodevelopmental goals for trauma treatment. So what about art therapy goals for trauma treatment? What are we looking to do? We can desensitize, almost like prolonged exposure, repeated exposure, through creating imagery that is reminiscent of the traumatic event to decrease the amygdala response. Work on building an expressive vocabulary, again, connecting the experience part of the brain to the verbal processing part of the brain and attaching words to those memories to help get them into the long-term storage. Using that sacred space to symbolically repair the damaged object, or use that sacred space to explore potential desired or different outcomes. Self-soothing, right? Safety and comfort through mastery of the media, through process and content. Reworking the loss. I talked a little bit about changing the narrative. And promoting neuroplasticity, or working on building other neural pathways. And lastly, in all trauma treatment, we're going to have plans for ongoing care. So specifically, some of the benefits of art therapy for treating PTSD is reconsolidating or getting into long-term storage implicit and declarative memories, right? The sort of the visual memories and the verbal memories, connecting them up and moving them into long-term storage through the power of image making. Again, I talked about this kind of idea of in vivo or virtual exposure through process and media. Externalizing, right? By actually creating this image or images or sculpture or art product that becomes externalized and out of the self and into the other and sort of objectified. Again, this reduction of arousal or self-soothing, regulating. Self-efficacy, right? Mastery through media, process, and content. And also experiencing something joyful or a connection to self and others. Sometimes when people ask me what my job is, if I'm feeling particularly sassy, I might say, my job is to foster joy. And lastly, improve self-esteem. I feel like this is often an overused term in therapy, but we can change and improve self-perceptions and alter cognitive distortions. So before I wrap up, I just want to give a cautionary note. Maybe some of you have seen this image floating around Facebook. The story goes something like a school class was asked to draw pictures of what they wanted to be when they grow up, and the teacher was horrified to receive this image of the little boy's mother apparently dancing on a stage with a pole. And with further prompting, it was discovered that the boy's mother works at Home Depot, and it was the evening of a big predicted snowstorm, and this was the last shovel that was being auctioned off. So art therapy is not tarot card reading, it is not voodoo, it is based on the relationship and knowledge of counseling theories and art therapy media, processes, and content, and can be particularly effective in treating trauma from a neurodevelopmental and neurobiologically informed perspective. Thanks for letting me come into your class today, and I look forward to potential live lectures sometime in the future.